So now I am going to demonstrate the running continuous sutures on the surface. Now where exactly we need the running continuous suture? So when we are closing the skin, if this thickness of the skin is too thin, there is no layer of the fat, as well as the wound excision was not that much deep. Suppose we are working on the periorbital region for the blepharoplasty, or for the infraorbital fat removal, or maybe for the xanthelasma, the thickness of the skin is very much thin. So in this area there is no tractional pull from the surface, as well as the depth of wound is not that much. So in this type of cases we will be taking running continuous suture. So on either side we will be putting the knot, and in the throughout the length of the wound we are taking running thread. So here we demonstrate running continuous suture. So the first suture will be resembling that of simple interrupted suture. So entering from one side, exiting from other side, taking the needle out and giving the knot. 1, 2, 3. 3 loops are given, holding the thread and giving the closure. Rotation of the thread to fix the knot here, and then second knot, third and fourth, and then we will be cutting the second thread by 2 to 3 millimeter of the distance from the surface. So now I will be giving continuously. So entering from one side, exiting from another side, taking the thread out. In the same manner, repetition of the same movement, entering from one side, exiting from another side, not creating much tension. Tension is created just to give apposition of the wound margin. So when we are near to the end of the second side, we have to stop and to give the closure. So this will be my last prick of this running continuous suture. So when we are supposed to close, the last loop will be used as a second end of the thread. So this is a last loop and I will be using as a second end of the thread. So here we are putting 3 loop, holding the loop and giving closure. So this is the last tie. Correct. So as an analysis, so on either side there is a knot created to hold the suture material, and in the central part there is an oblique line of the suture we can see, which is a running of the thread. So it will give you the closure of the wound in a linear pattern, no overpressure created, as well as we can see there is no wound gap. So it holds the tissue for the 7 days of time, and 7 days is a time of suture removal. So the benefit is in the running continuous suture is only 2 knots on either end, and it will not create the pressure. So not creating the pressure will not give you strangulation of the vessel, so that your vascularity will be maintained. So as we are comparing it with the simple interrupted suture, the pressure created in individual simple interrupted suture is there, so there will be a strangulation effect and pressure created while we give the knot. So each and every suture is creating pressure, will give you necrosis of the margin probably, but in case of running continuous suture, pressure is maintained throughout the length of your running continuous suture. So no strangulation of the blood vessel, and the vascularity will be maintained inside the tissue. So chances of margin necrosis will be minimized in case of running continuous suture. The second benefit we are getting is we can adjust the tension created from the suture line at the end of your suturing, and that will be not possible in case of simple interrupted suture. So in those areas where actually the skin is thin and no much tension is required, the running continuous suture is more beneficial by these benefits.